when choosing the specific challenge that we have chosen, as you know, we discussed a number of challenges. And frankly, the one that appealed to me a great deal, and this, what we have chosen is a part of that, was to improve the delivery of public services, in our countries. And, we really admire the National Health Service of UK, and we would like to move in that direction. But, can we really afford a National Health Service of a certain quality in India? Can the government really pay for that? So, do we need innovation to make that National Health Service type setup cheaper? And from that we came to one specific area, because we happened to have somebody amongst our group who could point us in that direction. But you could talk of diabetes, for example. It's a major concern for Indians today. Could we sort of search together for a solution to many of these problems? Water and sanitation is a huge problem of public health in India, but we felt that there maybe we would not be able to get that much engagement of our youth from the UK, because it's not that much of a problem. So we tried to zero in on some diseases and see if we can innovate to make the cure for those diseases more affordable.
I believe heart surgery is the best model. The main reason is, if you can reduce the cost of a heart operation, it is very easy for you to reduce the cost of a gallbladder or a hernia operation. Heart surgery today is the most expensive operation. If you can bring it down to the level of a common man, automatically all the other surgeries will become affordable. So I'm glad that the advisory group chose $1,000 heart operation as the target.
It's a great first challenge, because even as you narrate the challenge, it sets your mind thinking. Is it possible to bring in a cost-effective heart surgery for less than $1,000? If it is, then what must be done? It's obviously not a unidimensional answer. So it's a great first challenge, because as one of the advertisements for some other product said, it's different. It makes you think, and it has a large number of sectors. It has governance issues, it has commercial issues, it has technical issues, so it makes for a perfect mix.
In terms of $1,000 heart operation, we have to start looking at every cost component. First cost, which is extremely high in Indian context, is the cost of building the hospital. If you spend $25 or $30 million to build a 300-bed heart hospital, there is no way you can do the operation for $1,000. You can't even do it for $5,000. So essentially cost of hospital. Then the next thing you have to look at is the number of operations, utilization of the infrastructure. Infrastructure is expensive. Then third one is the input cost of drugs and disposables. Then the fourth one is the manpower cost. As you do more operations, your salary burden goes down. So you have to look at every aspect of the cost factor in the heart operation. You can't address one issue and expect the cost to come down. But believe me, $1,000 can be accomplished.
Why is it that an affordable heart surgery is a challenge that I think our young people from India and the UK would get excited by? I think because, one, it's becoming a major problem in both countries. Second, it requires a mindset where the public sector trusts the private sector, and the private sector in return believes that, they can contribute because the public sector would want them to step in. And as you know, partnerships only work if both partners start with some trust. So that's the first thing. Second, even though in India, we have many communicable diseases and we need to work in the public health area, I think that is very much, that's a problem which is very specific to India. But we are also today facing lifestyle diseases, and because of our absolute numbers, that problem, that challenge also requires a solution on a certain scale. And here we found common ground that we can have, both sides come together. Also because it ties in with our admiration for what National Health Service has done. So we can look at the experience there, and we have enough evidence of innovation in this area in India. The Indian healthcare sector has really been innovating at a maddening pace because we need to, So we thought all of this, if it came together, we may be able to find some concrete solutions to this problem. Do I believe whether heart surgery could be done at $1,000 per surgery? Let me tell you, if I had not seen Devi Shetty's outfit, I would have found it very difficult to believe. But having seen what he is doing compared to what others in India are charging for heart surgery, I do believe that it is possible to push the frontier. And if we can really scale it up, if we can get the infrastructure on a certain scale, I believe it is possible.